and Dr. Dave Chokshi, Commissioner of New York City's Department of Health and Mental Hygiene. And Dr. Chokshi, it's great to have you on Yahoo Finance. I guess from your perspective, from the position that you're in, what do big cities need to do, I guess, to better get a hold of this Delta variant, to stop it from spreading, so we make sure that we don't lose some of the progress that we've made over the last several months?
Well, thanks so much for having me on this afternoon. The key is vaccination. One thing that we've learned about this virus over the last 18 months is that it is a formidable foe. It's wily. It will find the cracks in our armor. And right now, the biggest vulnerability with respect to the coronavirus, particularly the Delta variant, is people who remain unvaccinated. And so we have to have a laser focus on closing those gaps and ensuring that as many people as possible get the protection that vaccination affords.
Doctor, you have a big New York City fan here. I want to get a T-shirt that says, "I stayed through the last 16, 17 months," and lots of people left. One of the things New York did successfully was the mask mandates and the distancing. We're not at, and I hate this term, herd immunity, but we don't have the vaccination rate in New York City for fully vaccinated folk to get that. And nationwide, we're not even at 50% fully vaccinated. So is it time to go back to the mask mandates in New York as well as the rest of the country?
Well, this is an important question. Let me try to frame it with a couple of pieces of data that we actually just released earlier today. The first was a study by Yale and the Commonwealth Fund that showed that our vaccination campaign thus far has prevented 250,000 cases, averted 44,000 hospitalizations, and saved 8,000 lives thus far. The other piece of data that we released is that of all of the cases, hospitalizations, and deaths in 2021, over 98% of all of them were in people who were not fully vaccinated. So both of these things point toward the fundamental solution, which is vaccination. With respect to masks, it is an important consideration, but it's particularly important for people who are unvaccinated to keep up those precautions that did keep us safe over the last 18 months. That's masks, physical distancing, getting tested regularly, keeping your hands clean. But those are primarily to keep unvaccinated people protected. And the best layer of protection is to get vaccinated.
Doctor, you mentioned there that the vaccination campaign from the city saved 8,000 lives so far. I guess for those that are still unvaccinated, I know efforts are underway in order to reach those people. How do we reach those people? What needs to be done that hasn't been done in order to be successful here over the next several months, which is so critical in getting the pandemic, especially the Delta variant, under control?
This is a really important question, and thank you for asking it. I really think about it in the same way that I do when I'm discussing the vaccine among any of my own patients. It starts with listening. That's why we've had over 5,000 events like town halls over the last few months to understand what New Yorkers' questions are. But then it's going to take one-on-one conversations. We have door-to-door canvassers. We have nurses making phone calls to be able to have those very tailored discussions with people to get them more comfortable with the vaccine. Most importantly is for us to target the areas, the communities with the lowest vaccination rates. And so we have a few more things that we're planning to elaborate in the coming weeks and months. First is to deepen our mobile vaccination efforts. We've done over 100,000 doses through our mobile vans, and 17,000 people have been fully vaccinated through our in-home vaccination service, which is now available to anyone in New York City who is eligible for the vaccine. The other key part is working with trusted healthcare providers. Nurses, doctors, pharmacists, these are the people that we turn to for any healthcare, whether it's a COVID vaccine or otherwise. We have to make sure that at every clinical encounter, they're using that as an opportunity to talk about COVID vaccination, but then ultimately to make a strong recommendation for it and actually provide it optimally during the same visit.
Have health departments in other cities reached out to you or your staff for advice on the way we did it in New York City and what they should be doing?
we're constantly in contact with other health departments around the country. There's been a real camaraderie, as we all battle this pandemic together. And I would say there's a lot that we in New York City have learned from our colleagues around the country and around the world. I'm proud of the ways in which we've been a trendsetter, and particularly the ways in which our mayor has pushed us to make sure that we're, for example, lowering barriers to vaccination, like that in-home program that I discussed earlier. We have the largest testing and tracing apparatus in the country and perhaps even in the world. And we've been trying to communicate the changes that occur so rapidly because of the evolving science at every turn in a way that everyday New Yorkers can digest it and make important decisions for themselves and their families.